We are all born with hemorrhoids, but they do not bother us. It's only when they become swollen and enlarged that they cause irritating symptoms. Hi guys, it's your next door nurse Florence, and in today's video we're going to be talking about hemorrhoids. We're going to talk about what it is, the causes, the risk factors, the types, the signs and symptoms, the prevention, the complications, the diagnosis, when to seek medical attention, and the treatment. To my subscribers, thank you for sticking around. I love you guys so much, and if this is your first time of visiting my channel, you're welcome. Here we talk all about emergency health and wellness tips that will be of great benefit to you and your family. Please consider subscribing. Without wasting much of our time, let's get into today's topic. Hemorrhoids are a common problem. They are also called pile. They are swollen, enlarged veins that form inside and outside the anus and the rectum. The anus is the canal where your feces, that's your poop, comes out. The rectum is a part of the digestive system that connects the colon, that's the large intestine, to the anus. Hemorrhoids affect people of all ages, genders, race, and ethnicities, but they are more common as you grow older. They can be painful, uncomfortable, and can cause rectal bleeding. The major cause of hemorrhoid is straining, which puts pressure on the veins in the anus and the rectum. Hemorrhoids can also be due to 1. Pelvic pressure from weight gain, especially during pregnancy. 2. Pushing hard to have a bowel movement, that's to poop, because of constipation. 3. Straining to lift heavy objects or weightlifting. Although it is less common in children, anybody can get symptomatic hemorrhoids. You may be more at risk of hemorrhoids if you are obese or overweight, you're pregnant, you eat low fiber diets, you have chronic constipation or diarrhea, you regularly lift heavy objects, you spend a lot of time sitting on the toilet, or you strain while having bowel movements. Hemorrhoids can happen inside or outside the rectum. The type depends on where the large vein develops. It could be external, internal, or prolapsed. External hemorrhoids are swollen veins that form underneath the skin around the anus. They can be itchy and painful. Occasionally, they bleed. Sometimes they fill with blood that can clot. This is not dangerous, but can result in pain and swelling. Internal hemorrhoids are swollen veins that form inside the rectum. They may bleed, but usually are not painful. Both internal and external hemorrhoids can prolapse, meaning they stretch and bulge outside of the anus. That's why it's called prolapsed hemorrhoids. So I'm going to be talking about the symptoms of hemorrhoids based on its types. So for the external hemorrhoids, the symptoms include itchy anus, hard lumps near the anus that feel sore or tender, pain or ache in the anus, especially when you sit, and rectal bleeding. For internal hemorrhoids, they rarely cause pain and they typically cannot be felt unless they prolapse. Most people with internal hemorrhoids don't know they have them because they don't have symptoms. But if you have symptoms of internal hemorrhoids, you may see blood on the toilet paper, in your stool, or on the toilet bowl. The symptoms of prolapsed hemorrhoid include pain and an uncomfortable feeling. You may be able to feel the hemorrhoid bulging outside the anus and can gently push them back inside with a finger. Other conditions that can cause hemorrhoid type symptoms include colon cancer, Crohn's disease, and ulcerative colitis. Hemorrhoids can be diagnosed based on your signs and symptoms and a physical examination. You can also diagnose hemorrhoid with a digital rectal examination, an anoscopy, a sigmoidoscopy, and a colonoscopy. Some of the complications of hemorrhoids include anemia, blood clots, especially in external hemorrhoids, infection, skin tags, that's flap of tissue that hangs off the skin, and strangulated hemorrhoids. You should seek medical attention if your symptoms get worse or interfere with your daily life, or you do not improve after 1 week of at-home treatments. Also seek medical help if you suspect or experience abdominal pain, chronic constipation or diarrhea, fever and chills, nausea and vomiting, severe rectal bleeding and pain. The treatments of hemorrhoid include rubber band ligation, electrocoagulation, infrared coagulation, sclerotherapy, and surgery. The surgical treatments include hemorrhoidectomy and hemorrhoid stapling, but all these are done in the hospital. So please, if you notice any of the signs and symptoms, see your medical personnel immediately. Some of the ways to prevent hemorrhoids include: 1. Do not sit too long or push too hard when pooing. 2. Don't delay bowel movements. Go to the toilet when you feel the urge. 3. Drink plenty of water throughout the day. 4. Eat more high fiber foods like whole grains, vegetables and fresh fruits, or take supplements. 5. Being on the move keeps your bowel moving. Stay physically active. 6. Use laxatives or enemas only as recommended by your healthcare provider. Too many laxatives or enemas can make it hard for your body to regulate how you poop. Hemorrhoids often go away on their own without treatments. Symptoms like pain or bleeding may last 1 week or slightly longer. Some of the steps to ease these symptoms include: 1. Applying over-the-counter medications containing lignocaine or hydrocortisone to the affected area. 2. Increasing fiber intakes through diets and supplements. 3. Drinking more water. 4. Soak in a warm bath for 10 to 20 minutes in a day. 5. Soften stools by taking laxatives. 6. Take non-steroidal anti-inflammatory drugs for pain and inflammation. 7. Use toilet paper with lotion or flushable wet wipes to gently pat and clean your anus after pooing. So guys, we've come to the end of this video. I'm sure you've learned a thing or two about how to care for your hemorrhoids. That's if you have it. Give me a thumbs up if you find this content helpful and useful. Subscribe to my channel by clicking on the red subscribe button. Also turn on the notification bell so you'll be the first to know when I upload new videos. You can drop your comments in the comment section below and I'll attend to them. I remain your next door nurse and I'm just a knock away. I love you guys.